And we might want to wait a minute because there's no one on there.
Sure.
But you are streaming if you wanted to say anything.
Yeah, I'm waiting for it to pop up in my feed here.
Yeah, it just went live right now. I see it now. I'm gonna comment from my personal profile.
Should we go ahead?
There's no one. Well, now it says 5 people are on, 6 people, so people are finding it. So
Okay.
hello, everybody.
Okay.
Just 1 second here.
It looks like we had a loss of the video, so we're going to start up again.
Yeah, we were in the middle of answering a question, and it appears that YouTube flagged the video for some reason. So we'll be looking into that. But Doctor, you were answering the question about the cellular networks, 4G and 5G, and any kind of health concerns or supplements that we can take to help with that.
I was explaining that microwaves are at different cycles. The current one that we're using at 4G right now is at a certain cycle per distance, and then the next one will be at a more rapid cycle per distance. And when you use your microwave, that energy that is emitted in there generates an energetic cycle that resonates with the water molecule. All physical entities have an energy, okay? This desk in front of us has energy, the walls in your room, everything is emitting a cycle. And if you came back to this room 500 years from now, and no one came in this room, you know, hopefully we left it, but if you just came and looked at the walls and the ceiling, you'll see that it'll oxidize and slowly burn. And so oxidation is oxygen mixing with the molecules in the walls, your paint and everywhere. So everything is vibrating and everything is deteriorating. We're using this energy wave to resonate with water, and that's how it heats it up in your microwave. The next level of microwaves have a shorter frequency, and it appears that it has a resonation that links with oxygen, the molecule O2. So we need to be aware that if you have water in you and you need oxygen, you have to be careful of these electromagnetic waves. What would I do to take care? Well, we would say that you should put your phone away from you at bedtime and get these devices out of your room. There are people who are putting up cage. I forget the name of the cages, but it's like a drape over a bed, you know, that has a mesh in it to interrupt these waves. And these curtains, you might say, protect you at night. But it is oxidative stress that the damage is being done. Oxidative stress creates the molecular resonation and breaks up the material, whether it's in your cell membrane or cytosol inside the cell. So taking antioxidants helps you repair your membrane. Eating healthy organic fish and beef and chicken with the skin on it gives the fats and phospholipids that you need to repair cell damage, whether it's from microwave energy or just living in that day. Drinking enough water is an important thing. Getting a good night's sleep. Taking the product that we would use, the most researched antioxidant, would be the Juice Plus series, vitamin C, and eating fruits and vegetables rich in, you know, A, E, vitamin D, things like that. So that's how I would approach it.
Right, and if I added my thoughts to that, there's not a lot that we can do as individuals about what the big cellular companies are rolling out, other than, you know, banding together and advocating for where's the safety studies on this. You know, I don't think there's been enough research yet to show if it is truly harmful or helpful, but you know, we're just doing it anyway. So what can we focus on? The things you're mentioning to build up our oxidative
repair mechanisms,
systems, right?
yeah. And in general, the American diet is very poor, and we are under more oxidative stress, more stress in general. And these measures that we're taking here are in general extending the age. I mean, just on antioxidant, and this is what I've published on in 2000 in the American Nutraceutical Journal. I published it on oxidative stress that was repaired by, for instance, I did mine using the product Juice Plus, which is just fruits and vegetables and berries in a capsule. But there are 15 studies on oxidative stress outside of the research that I published. Plus there's another 4 on inflammation protection. There's 7 on DNA damage protection. And cardiovascular health has 8 publications, including in the Journal of the American College of Cardiology in 2003. So if you're saying what is the most researched nutraceutical out there, it is the Juice Plus series, and it has the greatest effect uniformly on all these multiple levels. And so that's why I would strongly recommend it.
And Karen mentioned, I think you're talking about a Faraday cage.
Oh, Faraday cage, that's the right. Faraday cage is talking about having a barrier to drape over yourself or any electronics, and we are essentially electrochemical beings so that you can rest at night.
Okay. If you did ask a question on the last video that suddenly stopped on us, I did grab those. So I'm going to go with those first, and then we'll get the questions that just came in. The next question we got was from Bobby asking, how helpful is liposomal vitamin C? Is it helpful to take both Vitality C and a liposomal vitamin C?
Our research on cell membrane repair what predated what is called liposomal delivery of both medication and nutraceuticals. And our research was on the phospholipid cell membrane. It's a double layer of phospholipids in the cell membrane. And when you eat your meat and your fish and your egg yolks and things like this, you're getting plenty of these healthy phospholipids in, plus essential fatty acids, linoleic and alpha linoleic acid. And this then is what is used to wrap vitamins or medications in to help it be presented as needed at the cell membranes wherever the body needs it. It extends the time release, you might say, as well. Very often we find. So liposomal vitamin C is very good. Liposomal glutathione, liposomal anything, is a superior method of delivery of all the nutrients. So I would encourage it. I would say it's a valuable thing to incorporate into your diet. Water-soluble vitamin C in the form of the powders that we have give an immediate burst and surface area to your membranes, where often a lot of pathogens come at us. So I see a role for both water-soluble vitamin C in a drink as well as the liposomal, which has a deeper, long-lasting
Is the
effect.
Vitality C, is that already a liposomal, or is that
No.
not? Okay.
No, that's a water-soluble one.
And I will mention that we did get more Vitality C in stock. They released some more, which is wonderful, but it was a limited quantity, so I don't know how long those will last. We'll probably run out of that again, but we're trying to stay on top of that vendor to get more in. We also have the buffered C powder that comes in and comes out. The supply chains for everything in healthcare right now have just been very irregular and interrupted. Next question is, nutritional yeast safe, especially if you have candida? You know, I can't say I've ever heard you prescribe yeast before.
Brewer's yeast has always been prescribed as a very good source for the B complex series.
Okay.
And it's a very rich source of B vitamins.
It's also a common allergen, though, isn't it? I know when I did my immuno-food allergy test, brewer's yeast showed up for me as an allergy.
Right. But yes, it is a source of good B complex vitamins. So I'm not anti, nutraceutical brewer's yeast and things like that. I tend to prefer the B complex, and we've made it into methylated complexes, which helps step over areas that we're finding SNPs or little areas in the genome that makes it difficult for human beings today more and more. And could this be from oxidative radiation and electromagnetic energy? It might be, but these SNPs we step over by using our methylated B complexes, which of course are superior.
Okay. Blake, are you seeing any questions? Mine didn't refresh.
Yeah, one I did see was they asked if you can drink too much water.
Yes, the question was, can you drink too much water? Yes, there actually is a water intoxication, and it has been documented that over drinking of water will dilute out your minerals, which are cofactors in electrochemical messaging, and you'll often get a cardiac arrhythmia and then possibly death, and we have seen this. So in general, the statement is you should, whatever your pound of weight is, if you're a 200-pound man, cut that in half, 100, and that's how many ounces you should drink per day, or a half ounce per pound. So if you're a 150-pound woman, it would be 75. Now, in California here, where it becomes very warm, I would increase that by at least 10%.
Okay. Maybe, and how hard would it be how would you know if you're drinking too much water?
Well, you know what your weight is, okay?
Okay.
So a gallon is 128 ounces, I believe. And a man who is over 200 pounds would probably be safe consuming a gallon of water a day if he's very active outside and sweating a lot. That should do him well. But a woman, that would be too much. So if a woman was 150 pounds at most, 75 ounces plus 10% more would get her, I would say, a limit of 90 ounces, which is like 2/3 of a gallon. So you have to have these parameters.
Right.
Same for your children.
We see people erring on the other side of that equation more often than not. People are not
Oh, no.
hydrating enough.
Absolutely. We are a socialized, driven, marketed people, and we're buying fun things to drink. We're being driven by our taste buds and our pockets for buying all this stuff. Usually it's not drinking enough water. You could get too much oxygen. You know, the original babies that were put in incubators, they gave them 100% O2, and they wound up getting too much oxygen, and they developed eye disease and blindness from this. So yes, we are in a delicate balance in all these things. Interestingly, in the world of the SARS-2 virus, they're finding, some of the articles since I last talked to you last week are talking about microcoagulation that is in the blood system. And this microcoagulation may be actually the real cause for the demise and the low oxygen. They call it hypoxic, as opposed to what they would justify by just looking at the lungs and the inflammation there. And so the understanding of oxidative stress is becoming more and more amplified. Therefore, using Juice Plus, for instance, you know, I just listed 15 scientific articles on reducing oxidative stress. And the one in the Journal of the American College of Cardiology in 2003 actually cut off the blood supply, created hypoxia for 5 minutes, and then they made studies after they released the pressure and allowed the blood flow. And they actually found that taking the fruit, vegetable, and the berry food concentrate in the capsules mitigated the inflammatory cytokine storm such that it was almost unnoticeable on those studies. So if we're looking at the tiny microclots, they're starting to see it's in the lining of all the blood vessels throughout the body. The endothelium, which is the inner lining of your blood vessels, they have receptors on them, ACE2 receptors as well. And if the replication of the virus is not only attacking ACE2 receptors on lung cell alveoli, it's also doing it to the blood vessels. And with that, then it produces essentially a cytokine storm, hypercoagulation, microclots, and so forth. So we feel that taking that vitamin C, remember they were doing studies on high-dose vitamin C intravenously to these patients, and they did better. Well, it makes sense because vitamin C is a powerful antioxidant for the body, which helps to mitigate this. Now, interestingly enough, I had brought this up before, chelation therapy, IV chelation therapy, helps the microcirculation as well, helping to keep those endothelium of the blood vessels producing the nitric oxide. EDTA itself can produce more nitric oxide and vasodilation, which is stopped by these storms that we're talking about from this viral illness. So if we could intercalate or add into the therapy the anticoagulation effect of EDTA chelation therapy with the vitamin C, with whatever therapies they may be choosing, the zinc with hydroxychloroquine, azithromycin, I think it would mitigate that. And the EDTA is an FDA-approved drug for removing lead in children that have acute toxicities, but we need to go to the FDA and say, make this allowable for treatment and billable to insurance so that we can improve microcirculation as well and natural nitrous oxide production.
Thank you, doctor. That's great. I had a question about, this is a new one, sea moss. I was wondering what you think about sea moss.
Sea moss? You're
Yes.
talking about the moss that grows in the ocean?
Yeah.
Yeah. Well, yeah.
Iodine, I'm assuming, like
Yes.
as a source for it?
Yeah, that is a very hyper-concentrated mineral nutrient, and iodine's one of it, but there's also zinc in those things as well. So our world is full of wonderful, supportive for our immune health, our innate immune health to resist these issues. You know, I'm in the senior group where they would say people my age and older would be at a higher risk for viral exposures. But I have taken such good care to drink water, not juice or sodas. I don't eat late. I eat a low-carb diet. I do enough aerobic activity regularly. I get a good night's sleep. And I am sure to try and get in some fruits and vegetables, and I absolutely do it with my Juice Plus, my vitamin D, my enzymes, and systemic enzymes would be another thing that would be very
Yes.
beneficial to prevent inflammatory debris. So our world is full of wonderful nutrients and foods and water and sleep. You know, daytime, suntime, the sun gives us vitamin D as well. So we live in a wonderful place, but let's build up our immune system, which is our first defense. Please put your focus on that always.
Next question comes from, it looks like Deborah's up next. Because of the quarantine and isolation, do you see more people who are troubled with anxiety, depression, alcoholism, drug and domestic abuse? Social networking is so important, I believe.
I would absolutely say I have been here every day open since this developed. We've never shut our doors. And although I have none, basically, of the upper respiratory problems, and none of my patients needed even intervention with sending them to the emergency room or being hospitalized, I am seeing plenty of people who are so fearful. They are asking me for anti-anxiety prescriptions or natural suggestions. And indeed, I am seeing depression. So these social things, and by the way, socialization is one of the best means to improve your immune system, your innate immune system. And all kinds of studies show that if you're married, you tend to live longer. If we know,
Happily, I'm assuming.
yes, happily. And also, we know that babies, newborns, if they are not handled and loved and touched, they will die of themselves.
Right. Good question. Next question is spirulina a good preemptive strike for corona?
Spirulina is a green that is full of vitamin C and nutrients, so it's a very good antioxidant food source. So I endorse spirulina. I think it's a very good green that you can be taking in.
Yeah, I think one of the challenges we mentioned sea moss and spirulina, some other things like this is it depends a lot on the company that's making them and their integrity and their process and their sourcing. That's why we've chosen to partner with primarily orthomolecular products because we trust them, we visited them. So we don't have a spirulina product that we can recommend. We recommend Juice Plus because that's where the research is and that falls in that similar vein.
Right. I have to go where the volume of science exists. There needs to be more science in building up preventative medicine, our innate immune system, rather than looking to just drug prescription solutions. We need that research out there, but we are woefully overshadowed by a pharmaceutical solution, a imaging and surgical interdiction into our healthcare management. And so I would say we need to teach the things that we are doing here to the general practice so we can reduce the need for these special problems and improve the resilience. I hope to die when I'm, over 100 years old and I just go to bed and I don't wake up. No resuscitation, none of this excitement, and just give up the ghost, so to say. That's what we want to do. That's called rectangularization of the curve. Dr. Reitzinger, I think, is the doctor who published this about human growth hormone. This was in 1991 in the New England Journal of Medicine. And the rectangularization of the life expectancy curve is, he studied elderly people and he gave them human growth hormone. And he found that they perked up and they started exercising and doing well. And this kind of added to this whole anti-aging movement and natural hormone therapy replacement. And he said, we should have a full life from our youth and birth, and then one day it's ended, rather than all this disease we're starting to see in our young people today as well. We're actually seeing the life expectancy curve start to become diminished.
Okay, well, time for maybe one more question, then we'll start wrapping up here. I have a question. I've been diagnosed with gout, but the blood work came back negative. Could I still have gout, or was that a misdiagnosis? What are some things I can do to cure it?
Yes, you could still have gout, because if you're changing your lifestyle and living a healthier, cleaner, less oxidatively stressed lifestyle, your uric acid level can go down. What is there to treat it? Well, water. The number one thing that we should all call our first nutrient, and it is our first nutrient here at Tustin Longevity Center, is water. And having well-hydrated synovium of our joints, having a good microcirculation with that water, reducing the sticky, gummy sugars and starches and fruit sugars that clog up our microcirculation throughout our body, and taking systemic enzymes like vascuzyme or vitalzyme or proteozyme. These are enzymes we take on an empty stomach that are absorbed, and they help disinflame us, especially as we get older. The elderly tend to drink less and less water. They tend to become dehydrated. And with that, their blood becomes more hyperconcentrated, so even normal levels of cellular waste and debris become marginally more irritating to the endothelial lining of the microcirculation, whether it be your joint or not, which creates hypoxia, which creates more cell breakdown and damage. Getting plenty of antioxidants in yourself, like the Juice Plus series, would be very good, with the enzymes, with the water, with a low-carb diet. There's the argument that there are certain proteins that promote or would aggravate gout. I would be on a modest protein diet. There are certain plants that have a lot of oxalic acid in it. You would want to Google that, oxalic acid in plants, and maybe minimize those as your vegetables. But that would be a good place to start.
Good answer. Thank you, doctor. Well, we're just about out of time. Unfortunately, I have to get Dr. Elthorpe to see some patients in person or via telehealth. But I want to thank you for joining us. Thank you for interacting and bringing your questions. We really do want this to be a participatory event. We look forward to seeing you every week here. What I'd ask of you all, if you're watching and if you're watching regularly, we would like to hear back from you and get some feedback. If you're watching live, of course, you can put that in the chat section. If you're watching this video and it's outside of our live weekly Wednesday, put it in the comment section underneath the video. You can ask your questions there. You can make suggestions. What are some topics that you'd like us to hear from? If you'd like a different format or a different time. Our world is changing now, and the way that we interact with our patients will, I'm sure, forever be changed. So we're looking for ways that we can best serve you, our patients, and the public. So please do invite your friends and family. You don't have to be a patient here to participate on this Q&A. Docs, thank you for your time, and audience, thank you so much for joining us. We look forward to...
The person asking about gout,
Yes.
I think is going to be very sad if we don't answer their final
okay.
cover up. The little question here is sourdough made from homemade sourdough bad for gout?
Is homemade sourdough bad for gout? Well, that's gluten. And what component of a gluten grain product contributes to your overall inflammation in your body would be the question. So I would eliminate grains probably from your diet to isolate, that as one of the causative factors. So I would say that's probably not a good thing to be using.
We do pretty regularly. It's been a while since this coronavirus thing has happened. A detox with our patients, and that follows an elimination type diet.
Right.
And then after that weekly program is done, that 1 week program is done, we advise them to slowly reintroduce foods to see if there is a reaction. So what you're suggesting, we know breads and grains, glutens tend to be an issue for a lot of people. Certainly.
Joint pain.
Yes.
Yeah.
Let's try eliminating that for a while.
And we have tests here for doing it. So
We
if
do.
you could come in and see us, we could do some testing as well as improving all of your well-being. But of course, gout has prescription medications, colchicine, allopurinol, that interdict in these areas where the uric acid is promoted. But I will tell you, alcohol in a high fruit sugar diet will also produce uric acid excess. So it could be your carbohydrates as well, especially fruit sugars or alcohol.
Great answers, Doctor. Thanks again, guys. And all I said before, let us know how we can best serve you. Subscribe to our channel, like our videos, and join us next week. We'll be here as we regularly are, Wednesdays Pacific time, 9:45 a.m. until 10:15 a.m. ish.
Okay.
Thanks for joining us, and we look forward to serving you next week.